that video title lets you know everything. Yep, I've been diagnosed with cancer. And I was just thinking that, this would be a great way, basically for myself and I guess for you guys as well, just to see how, someone deals with that. For me, it's, I think it's about more of, documenting this and being able to, hopefully when I'm cancer free, to look back and see how I dealt with it, what I did go through and, the change, I guess, in myself. But look, I figured I'm supposed to start treatment in 2 days. I'd been wanting to make a video about everything for a little while now, but just hadn't got around to it. Obviously still coming to terms with a few things. But look, let's just start from the start, how it all happened. And I guess how it did happen was I started to notice, small things. I was going to the toilet really often to do number one. It was also really, really difficult. So that was odd. I started going to the doctor. I also had pain, in my pelvis, in that sort of region down there. Went to the doctor. They assumed that I just had some sort of infection. I did a fair few blood tests, everything coming back normal. So no infection. And I did a couple of ultrasounds on some bits down there. They came back normal. Anyway, my doctor said that, that she can't understand why I'm having any issues. I might just, it could just be something that'll blow over. Anyway, I suggested, what about my prostate? I was having pain, in that region. Anyway, so the doctor sent me away to go get a scan done on my prostate, and the results came back and, enlarged. Pretty enlarged. I think it was double the size that it normally is, or almost 3 times as big. So, again, she thought it was some sort of infection. So I was on antibiotics, still going back and forth, doing different tests, different blood tests. Anyway, nothing was decided, confirmed, or anything like that. And she basically said that there's not much more that she can do, so she's going to refer me on to a specialist, which she did. This was all happening. This has been happening for about 2 or 3 months now. Anyway, so she referred me on to a specialist, and that was probably about a month ago now. After being referred to the specialist, about a week later, I got severe back pain. I'd had back pain leading up to this particular day. It was bad, but, somewhat manageable. But this day, it was Tuesday, working from home, and it was probably some of the worst pain that I've ever had. And I decided, it's bad enough that I've got to go to the hospital. So that's exactly what I did. Went to the hospital, told them what happened, told them the history of everything else that I've been going through, that I've been referred to a specialist, all that sort of stuff. They did a CT scan on basically my kidneys and down. They decided they saw that there was an obstruction, well, not an obstruction, but essentially my prostate, being as large as it was pressing up against my renal system. It was not allowing my kidneys to drain, and that's why I had the back pain. But also, I was told essentially at the same time that was pulled aside with the urologist, the specialist in the hospital, and was told that it wasn't the prostate itself that was enlarged. There was a mass in the prostate that had grown and was now obviously affecting the prostate and pushing up against my bladder and pushing up against the renal system. And they told me then that it was most likely cancerous. Bit of a shock, as you can imagine, I'm sure. But they were unsure what type of cancer and, exactly what it was. So anyway, I was admitted into hospital. Spent about a week and a half there, back and forth doing different tests, couple of different surgeries. And the surgeries, I guess, include when I first presented to emergency, I couldn't do a number one, so I got a catheter put in. Don't recommend that. Don't. If you can avoid it, avoid it. So I had that in for a few days, and that was an absolute nightmare. Then when they basically, because my kidneys were blocked, they put me in for a surgery to get stents put in. Also, with the stents, they got these tubes called nephrostomy tubes. Essentially, when they don't drain through these tubes, they can drain into these nephrostomy tubes into bags, leg bags, which I'll show you. These things. I've got 3 of them at the moment. Got one. Sorry, yep. I've got 3 of them at the moment. I've got 2 bags for the nephrostomy tubes, obviously 2 kidneys, one either side. And I also have a bag for the catheter, but it's a better one, not one that I'm saying you shouldn't get. I got another one it's called an SPC, a suprapubic catheter, I think it's called. Can't remember exactly. But basically that one goes into your belly, straight into your bladder, which is much better. Anyway, so I had those surgeries done, and I had a biopsy done. Biopsy came back saying that, yep, was a cancer. And they think it's something called a small round blue cell sarcoma. Anyway, they essentially referred me on to Chris O'Brien's Lifehouse and another specialist urologist and oncologist to basically handle my care from there. And that was probably about 2 weeks ago now. Met the oncologist twice now. I've met my new urologist, who will be my surgeon later on. And everyone's been great. Everyone's awesome. But essentially the plan is that, so I start chemo on Friday. I should anyway, just depending on, I got another biopsy done because they want to just confirm exactly what type of sarcoma it is. It can get pretty convoluted. I think there's a whole different bunch of sarcomas under the branch that they think I am. So they needed more tissue to do some more tests. Anyway, so the plan is to do chemo for at least 3 months to begin with, and then it's looking like major surgery. In that surgery, it's going to be most likely the removal of my prostate and the removal of my bladder. So I'll end up with a bladder bag, essentially for the rest of my life. But yeah, so that's caught up to speed, I guess. I just figured I'd make this video, to, like I said, for myself, for later, to look back on, for other people maybe going through it, or if you know someone that's going through it, just to get, I guess, a different perspective and see how other people deal with it. So I guess from now on, it was a bit late getting started. This has all been about a month, about 4 weeks in the making, from being told that I probably have a cancer to now just about to start treatment. So I'll bring you along, and I guess we can do this together. And I look forward to sharing everything with you. So yeah.